Hello, everyone. Thank you for your patience and thanks for joining today's webinar, Making Healthcare Count, Health Policy Impacts of the U.S. Census. I'm Catherine Martucci, Director of Policy and Programs at the Alliance for Health Policy. For those that are not familiar with the Alliance, welcome. We are a nonpartisan resource for the policy community dedicated to advancing knowledge and understanding of health policy issues. I want to take a moment to thank the National Institute for Healthcare Management Foundation for sponsoring this event. And remind everyone that you can join today's conversation on Twitter using the hashtag AllHealthLive and follow us at AllHealthPolicy. We want you all to be active participants in the discussion, so please get your questions ready. You should see a dashboard on the right side of your web browser that has a speech bubble icon with a question mark. You can use that speech bubble icon to submit questions you have for the panelists at any time. We will collect these and address them during the broadcast. You can also chat any technical issues that you may be experiencing. Also, please be sure to check out our website, allhealthpolicy.org, where you can find background materials that accompany this broadcast, including slides, a resource list, and an expert list. And a recording of today's session will be available there soon. And now I'm so pleased to introduce Tammy Luby to moderate today's discussion. Tammy is a senior writer at CNN. She covers healthcare and the economy. Prior to joining CNN in 2008, she worked at Newsday and Crain's New York Business. She also teaches journalism at the Columbia Graduate School of Journalism. Tammy, thank you for being here today, and I will turn it over to you.
Okay, well, welcome all. I'm honored to moderate such an expert panel on census and health policy matters. I have long used census reports in my coverage of health and safety net programs, and while I knew the decennial count was critical for determining the number of seats each state gets in the House of Representatives, I was not as clear about its role in the vital programs such as Medicaid, food stamps, the Children's Health Insurance Program, and other government assistance programs. When the accuracy of the 2020 count was called into question earlier this fall, I thought it was important to explain the connection to readers. I found out that the federal government relies on data derived from the decennial census to distribute roughly $1.5 trillion in funds for these programs, along with more than 300 others. The money goes to state and local governments, nonprofits, businesses, and households across the nation. Today, the Alliance for Health Policy has brought together 3 experts who can lay out in much more detail the connection between the census and these programs and how this year's count will impact health policy in years to come. Here with me today to further discuss this case are a group of esteemed experts. First, we have Ms. Beth Link, a Senior Director at Census Counts Campaign at the Leadership Conference on Civil and Human Rights. In this role, Beth serves as the chief coordinator of the Census Counts campaign, developing a campaign that brings together community-based organizations across a wide spectrum of advocacy to ensure communities the census has historically missed are counted in the 2020 census. Next, I'm pleased to be joined by Dr. Andrew Reamer, research professor at George Washington Institute. Dr. Reamer joined George Washington Institute in 2010 after 6 years at the Brookings Institution's Metropolitan Policy Program and 20 years as a consultant in U.S. regional economic development and public policy. And finally, we have Kara Broomfield, a senior policy analyst at the Economic Security and Opportunity Initiative at the Georgetown Center on Poverty and Inequality. Kara leads research and policy development projects on issues related to jobs, education, and democracy. She also conducts research and technical assistance to ensure a fair and accurate count of marginalized communities in the decennial census. Thank you for being here with us today. Beth, let's start with you to provide a quick 101 of how the census data is collected and analyzed.
Absolutely, and thank you so much, Tammy, for that wonderful introduction, and thank you to the Alliance for Health Policy for having this important discussion today about the 2020 census and the important role it has in ensuring health equity and funding and resources across the country. As was mentioned, I am the director of the Census Counts campaign, which was working with partners across the country, including social service providers, healthcare providers, and advocates, cities and counties, to get out the count, ensure communities like young children, communities of color, rural communities, communities that have been historically missed in past censuses, had an opportunity to participate in this 2020 census. Particularly right now, we know that the communities that have been historically left out and as a consequence lose out on the resources and funding that their communities deserve can be some of the same communities that need the most resources and support in this moment as they plan to rebuild and care for their communities in this COVID-19 pandemic. So really important that we get this census right, because if not, it's going to hurt everyone. If we go to the next slide, I'm going to take us looking back a little bit about how the census data was collected and how it was impacted by the circumstances of this year. So the census is one of the most complicated, and actually the most complicated peacetime efforts that our country undertakes. It's in the Constitution, happens every 10 years, and is the counting of every person living in the United States, and really provides a snapshot of who we are in a given moment in time. And you'll hear a little bit more about how that data is used. As I mentioned, it's incredibly complicated. There are a number of mechanisms to collect that data, but to simplify, there are opportunities for households to respond on their own. We call that self-response. There's ways to reach folks who may be living in group quarters, like a college dorm or a military barracks, or in prisons and correctional facilities. And there are ways and opportunities to count people who may be unhoused or people experiencing homelessness and outreach that takes place. As you can tell, just given the wide diversity of our country, the meticulous planning for a census takes a decade, and that deployment is very sensitive, obviously, to the circumstances of a given moment. In our 2020 census was not normal, as this year has not been normal. So the census starts in Alaska, in remote Alaska, and it actually started in January. And then for the rest of the country, we had an opportunity to start to respond to the census in March of 2020. That's also when COVID-19 really started hitting the United States hard. And so as a result of that, in April and May, operations were suspended, and the Census Bureau had to stop a lot of their work, stop their outreach to rural communities, stop their hiring. That kind of took place over what is the reference date. So the kind of moment we're really trying to take that photo or that portrait of the nation, which is April 1. It was not until mid-May that field operations and hiring were able to resume again. As a consequence of that, door-to-door operation, enumeration, which counts people who did not yet respond on their own, started in July and August. And then the census, after a bit of confusion and back and forth with the courts, the enumeration period ended in October, or on October 15th. It was previously scheduled to end at the end of July. So as you can tell, if we go to the next slide, there were a number of things that impacted the timeline and challenged our ability to reach communities and encourage households to respond to the census. COVID-19 and that extended timeline was also impacted by natural disasters, hurricanes, wildfires that impacted the field operations, provided uncertainty about when and how households could respond. We saw mail delays, and in some rural communities, the specific outreach for those communities was impacted due to social distancing. Phone center capacity was reduced, impacting some wait times in that period when that in-person outreach was paused, and confusion about how people are counted. So for folks that were displaced due to economic reasons, or for students that went home, from college that would normally have been counted at their college, confusion about how they should be counted, where they should be counted, could ultimately impact the quality of the data that we see without robust data processing. We also saw impact of fear of government and timeline uncertainty as a result of some of the political machinations that were happening at the time and different political interference. If we go to the next slide, let's talk about where we are right now and what we can expect. So by statute and in the Constitution, the Census Bureau is directed to produce apportionment numbers to the president. Right now, it's outlined as December 31, 2020 for apportionment, and then the data used for redistricting would come no later than March 30th, 2020. There was major asterisks on both of those numbers because what we saw is, as a result of that impact from COVID on the data processing, well, on the census operations as a whole, but also it has also impacted the data processing timeline. In April, the Census Bureau and the administration went to Congress and said, hey, we're going to need more time. That was since reversed from the administration. And so there's been a lot of concern that the Census Bureau will not have the time it needs to process and tabulate the data. In fact, experts within the Census Bureau, the Government Accountability Office, and the Commerce Inspector General have noted that without more time and thorough time to process, tabulate, do the important work of checking that data quality and processing that data, we could have unacceptably flawed data and data of not an acceptable quality. If we go to the next slide, you'll just see here what this means and the impact on that timeline is that the vital data tabulation and quality checks in this 2020 year would be cut. That timeline would be cut in half from 26 weeks in 2000. They had 21 weeks to do that processing in 2010 to 11 weeks in 2020. That's why there is legislation before Congress and the House and Senate that's supported in a bipartisan way to extend that timeline so the Bureau has time to process it. We recently saw news yesterday that experts within the Census Bureau are saying that 11 weeks is untenable, and at this point, the data scientists are projecting delivery of the apportionment data between January 26th and February 6th. So that is kind of where we are right now. So what's next? If we go to the next slide, you'll just quickly see, I think it's important for us all to remember that the census is not over. While our opportunity to participate is done, important data quality checks are happening now and need time and space for that to get done. As I mentioned, there were a lot of different things that impacted census operations, and I can say as an advocate, a civil rights advocate, an advocate working to get out the count, we do have concerns about what impact that might have on the quality of the data, and particularly on those marginalized communities. That's why Congress has an opportunity to extend the statutory deadlines to give the Census Bureau the time and space it needs. And that's also why we're calling for transparency of that process so that we have information about the quality of that data once we see it, how this process is going, and to ensure that we get quality data that communities across the country can rely on. So that, I think, is my last slide, and I'll turn it back to you, Tammy.
Okay, thank you. And just to clarify, the redistricting data is due no later than March 30th of 2021.
2021, yes, that's right. And at this point, that is what is currently in statute. And as I mentioned, the census, there is pending conversations about and requests to extend those two deadlines by 120 days each, which would then put it to the end of July and put the apportionment data to the end of April. But at this point, March 30th, 2021.
Okay, well, thank you very much for that very good explanation of a very complicated process. So now we're going to have Dr. Andrew Reamer discuss how census data is utilized for apportionment and beyond.
Good afternoon, everybody. A pleasure to be here. I'm going to talk about the roles of the decennial census, broadly speaking, each of which actually affects health, mental health, and health policy. Next slide. So broadly speaking, the decennial census has a number of roles, and I want to note that the decennial census, it occurs because it's in the Constitution, and the sole reason is to count the number of people in each state to apportion the seats in the House of Representatives. For the first census in 1790, Congressman James Madison had the bright idea that, hey, if we're collecting all this information, we're doing a head count, why don't we get some information on the characteristics of the population so Congress can understand its constituencies better. And so that led to adding questions to the census, which has been done for 230 years. So the roles of the census are to, one, support democracy, apportionment in the Constitution, redistricting, as we said, and the enforcement of the Voting Rights Act based on people's race and ethnic characteristics. And again, each of these has a health implication. I think, people have lost sleep over the recent events around managing our democracy. And in addition, when there's a new president, there will be a change in health policy of all sorts, including around COVID. The second is promote economic growth, and clearly jobs is a very important element in people's physical and mental health. Businesses use the data derived from the decennial census to make decisions about where to locate, what goods and services to carry, and to determine how well they're doing. CNN, Tammy, and her colleagues, they only know about the market penetration of CNN because they have a denominator about the size of the population in the United States. The third function of the census is to facilitate effective and efficient government. That the data derived from the census are used to determine needs, to design and manage programs, to, as Tammy said up front, allocate grants and loans geographically, and to evaluate how well programs have done. And then the fourth is to enable social science, to enable scientists, social scientists in academia and in the government to understand the dynamics of our society as again, as we know, epidemiology is critical to combat the coronavirus, and epidemiology relies on good population data. Next slide. So the census is itself, the decennial census is rarely used for all the things I just mentioned because it only happens once a decade, and there's only a handful of variables: age, sex, race, ethnicity, and actually whether you own or rent where you're living, and that's pretty much it. But the census, the decennial census, is the basis for more current and detailed data sets that are used for all the things I mentioned in the prior slide. First is the annually updated population estimates, because you want to allocate money, for instance, based on the most recent population figures, not the one from 5 or 7 years ago. So pop estimates really are taking the variables I mentioned for the decennial census and updating them. How many people live in each community by age, sex, race, and ethnicity. The American Community Survey, which you might be familiar with, is a sample survey that it goes to a little over 2% of the population households every year, asking a wide variety of questions like income, occupation, educational attainment. It's from the ACS that we get poverty levels, for instance, which is a critical variable in the allocation of funding. And then the third major use of the decennial is to determine core-based statistical areas with MSAs, metropolitan statistical areas. That these are data-driven pictures of how we are living, how we are grouped geographically, and those are very important for all sorts of social science, and government analyses. So the next slide, please. I'm going to focus on, again, what Tammy brought up at the beginning, the use of census-derived data for the allocation of public funding. I say public because both the federal government and state governments rely on these data to hand out the money geographically. And here are the 6 primary uses of the data in allocating federal funding. The one is determining eligibility. And so, for instance, people on this webinar, I'm sure, are familiar with medically underserved areas, medically underserved populations based on census-derived data. If you want a community health center, you have to be in an MUA or serve an MUP. Households, the eligibility can be determined by the area's median income, which comes out of the American Community Survey. And applicants their eligibility can be determined by the nature of the population that they serve. Network adequacy, which is, a term that I think people in health policy, it's pretty unique to health policy. Basically, Medicare Parts C and D are operated on the basis of census population density data, and depending on whether you're in an urban, suburban, or rural area, that determines the requirements on you as a Part C or a Part D provider. Share allocation is probably the most easiest one to understand. It's formula grants, and there are many, many grants that Congress comes up with a number, and then the formula determines who gets what slice of the pie. Some grants are based on the entire population, regardless of characteristics, but most of them are based on a state or a community share of a population subgroup, like children in poverty or seniors, or urban adults adults 21 and older in urban areas, which is a homelessness formula grant. Then there are reimbursement rates. The biggest program is Medicaid, which relies on the FMAP, Federal Medical Assistance Percentage. CHIP, the Children's Health Insurance Program, does the same thing, and a few other much smaller programs. Medicare Part A, the reimbursement rates for hospitals depends on the area that you're in, and those areas are determined through the use of census data. Household voucher payments, for instance, Section 8 payments to a household to pay rent is based on the area's median income. And then lastly is there are many grant programs that are formula grants that every state gets some money. There are a number of much smaller programs where communities compete for a fixed pot of money. And those applications are scored on the basis of a variety of specifications, including the population size of the community, the poverty rate. For instance, a lot of USDA programs are scored that you get more points if you're in a smaller community. So that's a quick overview of the uses of the decennial census-derived data to allocate federal and state funding. I will say that for a lot of these programs, right, the money, for instance, WIC, Women's and Children Program, the money goes to the state. The state has to make decisions about where to put the money, and they rely on census data themselves for that. And with that, I'm done. Back to you, Tammy. You're on mute.
Thank you again. You laid that out very clearly for me a few weeks ago and now for the audience here. So we will now turn to Kara, who will provide specific impacts of the census on health policy and public health.
Thanks, Tammy. So yeah, my name is Kara Broomfield. I'm a senior policy analyst at the Georgetown Center on Poverty and Inequality. I'm very happy to be on this panel alongside some familiar faces. And my sincere thanks to the Alliance for Health Policy for having me. So I'm going to talk a little bit about key health policy and public health impacts of the decennial, like Tammy said. So at a very basic level, the census offers an understanding of how many people live where and what some of their characteristics are, like Andrew said. It also forms the basis of many other important surveys. Again, as Andrew alluded to, ACS, CPS, both of those track factors that impact health, such as income and housing. Another great example, CDC's data collection methodology for the National Health Interview Survey is based on the decennial census and is redesigned after every decennial. So this information allows our democracy to function. It allows us to fund programs appropriately, and it allows us to get really important information, health insurance data, data on disability, helps us understand rates of disease and mortality. It helps us understand and address social determinants of health and much more. Without fair and accurate census data, we can't do any of these things well. So let's go to the next slide. So I'm going to cover a few topics today, and I hope you'll come away with a few key points. I'm going to try to describe how census data provide a statistical backbone for public health data. I'll go into a couple key concepts related to fairness and accuracy of census data, and talk about the importance of accurate population counts in particular for understanding health rates. And then finally, I'll say just a little bit about how accurate census data are essential to responding to the COVID-19 pandemic. Next slide. So let me start with just a really quick but important note about undercounts. Like Beth said, the Census Bureau endeavors to count every person living in the United States, but it's better at meeting that goal for some groups of people than it is for other groups of people. And when a group isn't counted fully, there's an undercount. And when some groups are counted less fully than others, we see differential undercounts. And also, like Beth said, the folks that tend to be undercounted are the folks who tend to be in those marginalized groups, often people of color. People in rural areas face challenges to being counted accurately, people experiencing homelessness, people experiencing poverty, and the list really does go on, also young children. So one of the most important measures of how successful a census is are these differential undercounts, the extent to which one group has been undercounted compared to other groups. So you can see in this table here, the net undercounts for 2010, which was actually widely seen as a very accurate census. You can see that Black people were undercounted while white people were actually overcounted. These differential undercounts can have adverse effects for public health use cases, and health rates are one important example. Next slide. So before I go into health rates a little bit more, I wanted to show this map really quickly. This is a really cool resource from CUNY. This is CUNY's hard to count map, and it's showing self-response rates. There are really strong correlations between self-response and the likely accuracy of a census. And so while the overall self-response for 2020 actually slightly surpassed the rate for the 2010 census, there are really deep disparities between groups and between geographic locations. So if you're curious, you can pull this up and check out what it looks like for your community. This shows DC, where I live right now, and you can see some of that variation. As Beth said earlier, there's a really important in-person enumeration operation called non-response follow-up, which is designed specifically to help narrow these disparities in response rates. But unfortunately, the Bureau cut these door-knocking operations short, which we anticipate will almost certainly undermine the quality that we see in the data when all is said and done. So moving on to health rates in the next slide. As I said, on a really basic level, the census tells us how many people live where and some of their characteristics. But if our census data are inaccurate, that can impact our understanding of rates of disease and mortality. And that's because the census gives us the denominators for health rates. So a key question to consider is, how do these errors, how do these differential undercounts and overcounts affect our understanding of social determinants of health? How do they affect our understanding of health disparities between groups or between locations, between communities? How do they impact our understanding of health trends over time? All of these are really important questions that I think public health researchers and professionals should be thinking about. So you can see this is a toy example here, and it shows, just sort of demonstrates how a systemic error in the denominator can result in systematic bias in rate estimation. Okay, so next slide. So of course, the link between census data and health rates is incredibly important, but I also wanted to highlight just a few other use cases by briefly looking at how census data are used and responding to the COVID-19 pandemic. While the census data are not directly in use, since they're now a decade old, the annual estimates are often more useful, like Andrew was saying. But the 2010 census data forms the base for these annually updated population estimates, as well as the basis for ACS, CPS, other important surveys. So, you know, one could say that the decennial census then is the backbone of our federal statistical system. And when it comes to the COVID-19 pandemic, these census-derived data sets help us to track COVID-19 outbreaks, estimate mortality and infection rates, estimate community resilience, provide insights into where COVID-19 related healthcare will be needed most, and guide all sorts of other decision-making and resource planning. For example, ACS data are important in identifying counties with large at-risk populations. And census data can help us know where, for example, our elders are living, which communities they're in, so that we can understand which communities might be most at risk. Next slide. So this slide just shows one of the Census Bureau's COVID-19 impact reports. This is for the state of New York, my hometown. These reports are also available by county, and it just shows the types of critical information we get from the Census Bureau, though as I noted before, they're often not directly drawn from the census, but from these other surveys or analyses that come out of the census. But the decennial serves as the foundation. So I just wanted to show folks this so you can check it out, and you can go to the Census Bureau's website if you want to see what this looks like for your local area. So to wrap up here, I'd like to thank my colleague Jae-Jun Lee for preparing this presentation, though he wasn't able to make it today, unfortunately. And yes, I'll end there. Thank you so much.
Thank you so much, Kara. That was very helpful. So yes, now we're going to move on to the Q&A discussion. So I'll kick it off while the organizers are gathering questions. And remember, if you use the questions panel on the audience interface to submit your questions. And let me start off with, and this can go to any one of our panelists, regardless of the current administration's decision to shorten census collection time, is the normal allotted time enough to conduct a holistic count?
So I can start with that. One thing I will say is, as I mentioned, that the census operational timeline is something that is planned over the course of the decade. The Leadership Conference and our Census Task Force work on the census over the decade, and some of the other surveys, but work on the decennial in terms of the composition of the questions, looking at the operational plan, and the 2020 operational plan was finalized a full year before it was before it was implemented. The operational timeline usually spans and was projected to span between March of 2020 through the end of July, and that included all of the different operations for enumeration, including that non-response follow-up door-to-door outreach. It's a short period of time, and it's a lot is packed in, but the reason it's such a kind of short period is that reference date, which is April 1, and that's listed in the Constitution, is the kind of moment that you really want that snapshot of the nation. So for a practical matter, if you are counting your household and you have a baby born on March 30th, you would count that baby in your household. If unfortunately you have someone that passes away on April 2nd, they would still be counted because on April 1, they were in the United States. So that's what we mean when we say it's a snapshot. One of the challenges with the 2020 census is with the extended timeline. The further away you get from that reference date, the harder it is to ensure that there is integrity in that data collection. So if you're going door to door to households in September and saying, hey, who was living in your household on April 1, 2020, which is what enumerators were asking, the further you get from that date, the harder it is to ensure that there's integrity of that data, just because things change. And certainly in this year, things changed to a greater degree than normal decades.
I'd like to follow up on that. Thanks, Beth. One is that the time, there's an issue of time, there's also an issue of quality. And the answers to adequate time and sufficient quality will vary from decade to decade because of pretty radical changes in information technology. So for instance, this time around, the Census Bureau, Beth mentioned non-response follow-up, people going knocking on doors. Well, the Census Bureau doubled the productivity, I believe, Beth, of the door knockers through better scheduling through the software on their phones. So they were able to do many more door knocks in the same amount of time, which is positive. Regarding quality, so and again, as Beth alluded, time is needed both to gather the information, but you need sufficient time, and Beth really focused on that, to actually process the data. And big part of that is getting rid of duplications. Beth showed us that in 2010, the census said we really hit the nail on the head. We were off by 0. Well, in terms of accuracy, but when you look under the hood, you see that 3% of the population was counted twice, and 3% of the population was missed entirely. So the duplicates canceled out the people that were missed, and that's how we got to perfect score. This time we could have fewer duplications, fewer omissions, and a worse final score because the improvements don't match up. And one of the advances this time around, if someone does not answer their door and refuses to talk, what the Census Bureau has done in the past is impute the number of people and the characteristics of the people in that household based on what people look like in the neighborhood. This time, there's an intermediate step where the Census Bureau is using records, administrative records from 25 different sources to kind of fill in the blanks. It's an open question. Beth can speak to this about how much that will improve the quality of the count, but that is something that didn't happen before. So I want to give those extra dimensions to the question.
Okay, thank you. We have questions that are now coming in. Kara, one question for you. How does the shortened time for the census affect allocation of state and federal healthcare resources?
Yeah, that's a great question. I don't know, Andrew might have more to say on that because he's the one who did that impressive research about federal funding and census.
So the answer really is to what extent does the shortened amount of time affect the accuracy of the census? And if, for instance, New York City misses 20,000 people because of the shortened time frame, those people are gone for the decade. We don't get them back until 2030. So if New York missed 20,000 people and there's an allocation of federal funding for various health programs based on New York City's population share nationwide, it loses. And so one way also to think about this is whatever issues there are with the accuracy of the census, there are winners and losers. because for a lot of these programs, Congress is allocating money irrespective of the census numbers. It's appropriating $10 billion, $15 billion. So the question is, who gets what slice of the pie? A community can be undercounted because of the shortened time frame and actually make money because the level of its undercount is below the national average. And so basically, it's back to the differential undercount that Beth talked about. Whatever screw-ups happened, whoever has an above average amount of screw-ups loses, and whoever has below average amount of screw-ups makes money.
And one thing just to add to that is kind of looking to history. In the 2010 census in New Orleans, it was a number of years after Hurricane Katrina, but a lot of displacement still had not kind of corrected itself. So folks were still living elsewhere. And so when New Orleans was counted, there was had a significant lower number than in the following years. Folks started coming back to the city, and the result of that was that there was a huge deficit, particularly in education funding, but in healthcare as well, where the demand was so much higher than the city had resources for, as determined by the census data set by the 2010 census. And so it was really up to the city, to the state, to try and make up that difference. And that's one of the things that we'll see, and one of the reasons why cities, counties are so active in trying to make sure that their communities are counted. Because ultimately the impact is really going to be felt by those city leaders and in those city budgets and in those county budgets. And so what that'll mean for, I think, particularly in this COVID moment, in communities that are hit especially hard by COVID, that are already stretched, that are already seeing a lot of impact on a number of levels, that could be another blow, and there might not be the resources there to make up the difference. So, just reiterating again that the quality checks and the data processing and tabulation, we know this data is really messy. We won't know the quality of the data until we see the data, but we know it's really messy, and so for a number of reasons. And so it's going to be important to have time to really look at that to make sure that it's as accurate and that it's acceptably accurate for folks across the country.
I'd like to add one other impact for a big program, which is Medicaid. So after every census, the way population estimates work is that they take the decennial number, and then each year after the decennial year, they add births, they subtract deaths based on vital records, and then they make an estimate of migration. At the end of the decade, so that's what's happened from 2010 to the present, right, up to 2019. When the 2020 numbers come through, the Census Bureau is going to toss out all those population estimates going back to 2011. And they're going to replace them with now we have an endpoint, 2010, 2020, and interpolate. So after the 2010 census, Arizona lost 4% of its population, and Hawaii gained 4% population, because population estimates are just that, they're estimates. Medicaid is based on the prior 3 years average per capita income. So Arizona lost money in Medicaid because it got a lower population, so its per capita income went up and it looked richer than in fact it was. So an immediate impact, once the numbers for the states come out next September, is the numbers for 2018, 2019 get redone for every state, and there are new FMAP formulas. So if a state gets undercounted relative to the nation, it's going to lose money immediately under Medicaid.
And actually, to follow that up, using your research, Andrew, I had a paragraph in my story that said that had Texas's population been undercounted by 1% in 2010, the state would have lost nearly $292 million in federal reimbursements for Medicaid and CHIP in fiscal 2015, according to your research. Pennsylvania would have received about $222 million less, and Florida would have been sent nearly $178 million less. So we're talking about a lot of money here. We have some additional questions coming in. Can you discuss hard to count areas and the pros and cons of using technology? How did COVID-19 impact the plans to do outreach versus public spaces such as libraries, grocery stores, etc.?
Yeah, so I can start and should definitely jump in. So one of the things in a short time, I was trying to kind of stay streamlined on the challenges that we lifted up. But one of the things before the pandemic hit the country, we were really concerned about is that this was the first high-tech census. So this is the first census where the majority of folks across the country participated online. And it was new technology. There were a lot of tests and checks, but there was a lot of concern about, the impact that would have, particularly because we know for communities of color, for rural communities, and also in urban centers, there are disparities in folks' connectedness to the internet. And so the digital divide was a really real challenge that was of concern. But also in this moment of a highly connected environment where there's concern about privacy and data security, in addition to just a historic levels of fear of government, particularly among those marginalized communities, we had a lot of concern of would folks feel comfortable utilizing the census website, and where would there be a breakdown on race and among hard to count communities. So that was one of the reasons and one of the missions of Census Counts, to educate communities about the importance of the census, to get out in the field, do direct outreach and engagement. We did a lot of work in 2019, going around to communities across the country, engaging stakeholders, talking to communities about why the census is important, why we need to make a plan, why we need to prepare. Had a lot of plans working with the American Libraries Association, with local businesses to set up hotspots, to do events, to support questionnaire assistance. When in the early days of the pandemic, it was very clear in-person interaction was not going to happen. So we shifted to using digital engagement like phone banking and text banking. There was digital canvassing happening on tribal communities, some really innovative work by the National Congress of American Indians and their Indian Country Counts campaign. And in the latter days, I will say there were some mobile questionnaire assistance, so in-person questionnaire assistance happening outside of food banks. In Mississippi, organization called Southern Echo did incredible work preparing their disaster response to the tornadoes that were impacting Mississippi, with having some census questionnaire assistance happening at the same time to encourage folks, hey, this is really connected, because disaster dollars are connected to census participation. And so make sure that we're connecting. So we had to be really innovative to reach people. But I will say we're concerned that, and are seeing, as Kara mentioned, there's a disparity that we see in self-response rates. We know that on average, hard to count tracts, and particularly tracts of color, have lower self-response rates than other tracts. And that's just a fact based off of what we can see from the data right now. And so we do have concerns that the pandemic, natural disasters, and the kind of political climate had an impact on participation, will also have an impact on the undercount that we see.
And I think Kara, Beth, our next question, I think you have already answered it, but I will ask this if you want to add anything to it. Can you share early indicators of what this year's data is saying? What communities were greatly missed or undercounted due to displacement?
Yeah, well, I can say some of the things that I'm concerned about, and I'm sure others have. I think this is a really good question. Just to note that we won't know the quality of the data for sure until we see the data, right? But there are a number of quality indicators that we're looking at. I will also acknowledge Georgetown has an incredible resource about data quality indicators, which I'm sure Kara will talk about, and the American Statistical Association has produced a guide of data quality indicators that we're really looking at as a standard to measure against. From the outreach perspective and the get out the count perspective, important quality indicators are how did the operations function? So were there census operations that were planned that did not happen, or were there issues? We've been seeing some reports from enumerators or from Census Bureau staff that some things may not have worked as they should have, and so we're obviously looking at that closely. Self-response data is another really important kind of immediate quality indicator that we're looking at, and ensuring that the Bureau has time to finish all of the different tabulation and data quality checks is going to be another important quality indicator as we look in this, and that's why we're really asking for transparency, because that'll be important to know that they have a chance to do all the things that that the experts say they need to do.
Yeah, I'll add to that in terms of groups of people who have been displaced. It's a really good point. Lots of folks have been displaced by some of the climate-related disasters that we've seen happening more and more recently. I'm also concerned about the count of people experiencing homelessness. The Census Bureau does have some strategies for counting this group, but because places like shelters and food pantries, these are sort of the primary locations that the census targets to try to get an estimate of how many people experiencing homelessness there are. These places were impacted by COVID-19. And so we don't know for sure where the folks who would have been getting services at these places, you know, may have been or may have gone, and what impact that may have had on our ability to accurately count them. And yeah, Beth, I'm glad you mentioned our recent report on census evaluation for folks who are really interested in sort of the nitty-gritty about how we evaluate the census and figure out how accurate the census is. We do have a report out on our website that we did with a demographer named Bill O'Hare, who's really excellent. And if you're interested in that, you know, keep a lookout for demographic analysis. That's going to be one of the earliest indicators of quality that we'll be able to see. I believe that should be out in December. And those are independent national estimates that you can compare with the published census data, starting with apportionment data in theory. And that'll give us some of the first indications. So keep an eye out for that.
I will also add that another indicator that will be useful is the percentage of a count in any community that are imputations. Mm-hmm. Nationwide in 2010, 2% of the population was imputed, right? So that means the household was on the master address file and they couldn't get any information from the household, so they had to use algorithms to impute. If, you know, there may be communities where 10 or 15% of the population is imputed. That's that high, that's the problem. Yeah. Because imputation is just a guess, including you're guessing the number of people inside the household. So it'll be interesting to see what the level of imputations are nationwide. Is it still 2% or is it 5%? And then how do communities vary across along that average?
Right, and like you said, Andrew, one of the ways that we impute data is using administrative records. And with administrative records, the thing is that they're not as reliable and accurate for some groups as they are for others. And again, it's the people of color and the people with low incomes where that data is going to be much less accurate and reliable. So if we're seeing lots of imputation for those groups, that's going to be lower quality data that we get about those groups.
Right.
Yeah. And I'd say like specific communities that have the lowest self-response rates are particular communities that we're really concerned about. I'd say American Indian and tribal communities have very low response rates. Obviously, we're hit incredibly hard by COVID-19, and so that's an area of real concern. In urban areas, Black and Latino communities had lower response rates on average. And we're also seeing some impacts in some rural areas. And so we'll see kind of what happens, but those are some of the major areas of concern that we're looking at.
Yeah, thanks, Beth. I want to add one positive note in that is one of my co-panelists mentioned this is the first time there's an internet option to respond to and about half of the country responded on the internet. The quality of the data collected through the internet is much better than the quality collected through the mail, because in the mail you can check off 2 boxes when you're only supposed to check off 1, but the computer won't let you do that. So it will be interesting to see the extent to which there was a quality improvement because of the internet option.
Yeah. And I think it's, for all of our concern about whether the internet option was going to fail, I was chuckling with a colleague within the Census Bureau who was saying, remember we were so worried about that, and look, the contingency plans we didn't think about did take the fore. So yes, that's a good point, Andrew.
And to that end, I just want to recognize that the Census Bureau exceeded the self-response rate in 2010, I believe, during the pandemic, which, for all the problems we're talking about, is quite an achievement.
Well, I filled out my census response by the internet, so I enjoyed doing that. One question: should the government revisit how often it conducts the census? For instance, should it be every 5 years?
So that is a good question, and it's a good question. So actually, in statute, there is a provision for a mid-decade census. It could not be used for the purposes of apportionment, but Andrew, I think it could be used for reallocation of federal funding. One note is that the census, in addition to being very complicated, is very expensive. So the 2010 census cost about $16 billion. So there would obviously be consequences to adding another census. But
thanks, Beth. I want to add one historical footnote is that the mid-decade census was first proposed by President Ulysses S. Grant in 1869. Because the country was growing so quickly, he went to Congress. He said, look, the difference between 1860 and 1870 is enormous, and we should do this every 5 years. And that finally got passed, as Beth said, over 100 years later in 1976, but it was never funded. And the American Community Survey is sort of seen as the replacement for the mid-decade census, because up until 2005, there was nothing between the years ending in 0. There was a long form, but the last long form was in 2000. And now we collect a sample of data from a sample of households every month throughout the decade. And so in terms, the ACS is not about the count, it's about the distribution of characteristics, what percentage of the people are in poverty. So it is not a count. But it is a partial response to the need for a mid-decade census.
Okay, well, I want to thank everyone for their insights on this important topic. Unfortunately, that's all the time that we have for today. So I definitely want to thank our panelists for joining us this afternoon. And to the audience, please take time to complete the brief evaluation survey that you will receive immediately after the broadcast ends, as well as via email later today. A recording of this webinar and additional materials will be available on the Alliance's website. So Beth, Andrew, Kara, thank you very much for joining us.
Thank you.
Thank you.